Good evening, everybody. Tonight we have a 25 News Now special report. Every dose counts. We have Victoria Public Health Authority Dr. John McNeil and Victoria County Public Health Director David Gonzalez with us live in studio. You can call us during this live show. The number is 361-573-4366. My co-anchor Ozzie Mora is with us as well. Ozzie?
That's right. Thanks, John. And for the past week, we've asked for your questions about COVID-19. We appreciate your participation, and today we have the answers to those questions. Again, you can call this number during the live show, and we'll do our very best to get your question answered. So here's the number real quick. It's 361-573-4366. So a quick recap before we get started. The FDA fully approved the Pfizer vaccine earlier this week. This while the Governor Abbott announced a ban on COVID-19 vaccine mandates regardless of a vaccine approval status. So let's get started with Dr. McNeil. Doc, thanks so much for being here today.
Very glad to be here.
We have so many questions. I'm going to just go ahead and ask you. Here's the number one question. If I received the Johnson & Johnson vaccine, would there be a booster shot available to anyone or to me at some point?
Absolutely. You know, we've talked about boosters for quite some time because, you know, when these vaccines came out, we really didn't know exactly how long they were going to last. And so now they're thinking that 6 or 8 months. They've thrown out the number of 8 months to get a second one, 8 months from your last vaccination. So now they're saying it may be 6 months, but it's going to be in that range. Pfizer, Moderna, and J&J all are going to have third shots, and they'll be available probably in the mid-September.
I'm glad that you brought that up right now. The phone is ringing right now. One more question. How many unvaccinated people in and out of our hospitals with COVID have had COVID previously?
You know, there's not that many. I mean, after you have COVID, of course, you do have some natural immunity that is conveyed. And so that immunity is pretty good. So the idea of being in the hospital indicates that you're pretty sick. We don't put you in the hospital unless you're really having trouble breathing and or you have other comorbidities or other medical problems. So most of the people that are on there in the hospital, over 98%, are patients that are just unvaccinated.
Got it. We're going to keep on going. I have so many questions for you.
That's
so this is good. So keep on calling that phone number that we provided. It's 361-573-4366. Is it safe to go to health clubs for exercise?
Well, you know, right now the Delta variant is the predominant circulating virus in the United States. And I mean, basically it's all Delta right now. And that is a very contagious variant. So even if you've been vaccinated, you can still get the disease. Chances are you won't end up in the hospital, but you can still get sick. So you're going to be around other people. You're not going to know their vaccine status. It's hard to say. I still believe in social distancing, even at the club. Make sure that you wash your hands, wash the equipment, keep yourself clean, wear a mask if you're around other people.
Definitely. I do that as well. How critical is it to get the booster 8 months after the second shot? And what if I got it a few months early? It's kind of a complicated question, but
well, you know, actually that's actually been discussed and addressed because a lot of people are of the mindset, well, I'll get it early, I'll be safer. But that's really not true. The best thing you can do is extend the amount of time that you can be protected with what you have. So they're saying 6 to 8 months. Get your booster at that time, and that way you'll convey immunity. I will tell you this, there are some experts that think that the booster shots may not even be necessary because they're thinking that the immunity conferred from the initial vaccines may last more than a year or two.
All right, so that's all we have right now. So we're going to keep on getting these questions. I'm going to give that number one more time. It's 361-573-4366. Stay with us. More of your questions about the COVID-19 pandemic straight ahead.
Welcome back, and we're back with Victoria County Public Health Director David Gonzalez. Once again, the phone number to call is 361-573-4366. David, we have some questions for you now. First off, from our viewers, who should get the third shot and who should wait?
Yeah, it's a good question, Don. Right now, we're really looking at prioritizing those immunocompromised, severely and moderately immunocompromised folks in as the first priority as directed by CDC. And as Dr. McNeil mentioned earlier, the next phases are going to be those that, you know, it's been a significant amount of time, 8 months or so, maybe even 6 months. We're still not 100% clear on that when that's going to come down the pike. But really, those severely immunocompromised and moderately right now are going to be the ones we advise get that booster.
Does it matter how long ago you got your vaccination as you wait for a booster?
Yeah, also we're going to want them waiting 28 days since their last dose before they get that booster for those severely and moderately immunocompromised.
Can you mix and match vaccines? For example, if you took the 2 Moderna at the Mega Hub, do you need to take the Moderna for the booster? And do you have to go back to the health department for your 3rd dose if you got them at the Mega Hub?
Right. So to clarify, so we're going to want folks that that receive the Pfizer vaccine to get the Pfizer booster, and as well as the Moderna. You're going to want to stick with the same pharmaceutical manufacturer that you did on the first doses to get that. You do not have to go back to the same spot, though. You can go to a different location. There's vaccines available everywhere right now. You know, pharmacies, physicians' offices, as well as the health department. We don't do the mass hub anymore, but we'll be happy to take care of you at the health department in one of our clinics that we have.
Now, COVID-19 daily new cases have risen drastically in Victoria County from June to August. This information from David Gonzalez at the Public Health Department. Now, in June, there were 185 new COVID-19 cases in Victoria County. That's a drop of 286 cases in 1 month from May. But in July, 523 new COVID-19 cases in Victoria County, a 1-month rise of 338 cases. Average new cases per day in July, 16.9. This month, a huge rise in new cases, over 1,000 in 1 month to 1,660, an average of 63.8 new cases per day. Now, David, you and I have talked about what has spurred this big jump, and you've said the Delta variant is that. Can you explain how the Delta variant has really ramped up the numbers for new cases in Victoria?
Yeah, you know, Don, it's so much more efficient as a spreader. It's much more contagious. You know, that's really what we're seeing. We don't know the exact numbers on how many cases per day we get our Delta. That's really monitored on state and a national level. But we found across the country that it's such more, like I said, much more contagious variant of the virus itself.
And in the past, you have talked about the transmission level for COVID-19 here. What is the transmission rate currently for the county?
Right. According to CDC, it's high. I mean, obviously, that's where we're at right now. We had a huge increase, like you mentioned, since June. We're about a 10-fold increase since that time. We're averaging about 6 cases a day in June, now over 60, like you mentioned. Really, and with that high transmission rate are additional precautions that we ask folks to take. That's why we're looking at, you know, recommending masking, social distancing again to really combat that.
All right, thank you, David, and we will get back to David in just a little bit with more answers. Now, we want to hear from you at home, so call 361-573-4366 with your questions about COVID-19. We're back in a moment. Thanks for watching.
All right, welcome back to Every Dose Counts. Now, before we jump to the question, here's a look some information I was able to gather for you. Focus on children COVID-19 cases. So, a chart by the American Academy of Pediatrics shows cases in children have increased since July. Another chart by NPR shows children accounted for about 15% of all newly reported COVID-19 cases across the nation for week ending in August. One more chart for you. As for here in Victoria, last check, data by the Victoria County Public Health Department shows that there have been about 1,662 COVID-19 cases of people under the age of 20 years old. So I'm going to switch gears here and talk about COVID-19 cases with children. So here's a question. The Delta variant spreading. What do families need to know about risk for children possibly developing COVID-19?
Well, no, you said a lot of it. This entity is just so much more contagious. So before we would see patients, we'd see a family, 1 or 2 people would get it, and the family, the other people were spared. They even lived in the same house. It's not that way anymore. We're seeing entire family groups together. I know of a family that has 5 children, and all 5 of them are COVID positive right now. So it's so much more contagious. It spreads easier, and so we're seeing a lot more of it. And last time, with the UK variant, we didn't see that many children. This time is completely different.
Now, I was actually speaking to someone on the phone earlier today, and they asked me, why is it taking so long to get COVID vaccines for kids under 12?
Well, you know, the FDA is very careful. We have a procedure in the United States where we evaluate medications very carefully, and of course with children we're extremely careful. The other thing too is, you know, they have to test this medication. So there are trials going on right now with children. There's a couple of trials. I think they have 7,000 or 8,000 children enrolled. So we're expecting hopefully by the end of the year to have a vaccine for children down to age 5 or maybe even younger.
Now, once it becomes available, I'm a mom myself, and I would love to get my child vaccinated.
Right.
Should I be worried about the side effects or worried about her growth?
Well, you know, specifically a daughter, and I'll address this, and let me tell you, there's been a lot of things with females getting vaccinated because there was some stuff, I guess, on the internet talking about fertility worries later in life, you know. This has been fully evaluated and pretty thoroughly evaluated by the American College of Obstetricians and Gynecologists, the maternal fetal medicine people, as well as the reproductive endocrinology people. Those are the three big organizations that look at this. All of them have said that this vaccine has nothing to do with fertility. So as far as you said, your daughter. So
right,
I
my
would
daughter,
assume
she's 4.
Well, that's the thing. But you know, you still want to be a grandmother someday, so that's still going to happen. But that's what I'm saying. But as far as the rest of it goes, I mean, we're slow. And to your original question, we're very careful about approving vaccines, and we're especially careful with children. But you know, when you look at the schools right now, and you look at the numbers in the schools and the rampant spread in our institutions right now, a vaccine with children would be a good thing. Remember, those kids are taking it home to adults who may do poorly.
Now, one other question, allergies all over the place right now.
Right.
How can parents differ what could be COVID-19 versus allergies?
Well, we live in South Texas, and seasonal allergies are just part of the deal. Probably every chart that I see in the clinic, one of the entries says seasonal allergies. So it's not uncommon, but the symptoms are so similar. And pretty much in the last several months, when someone calls in and says, I feel bad, I got my seasonal allergies, this is what I have, I know it's not COVID. So I get them COVID tested, and probably 80% of them are COVID positive. Wow. The symptoms are very similar, so you really can't tell. But just remember that seasonal allergies don't typically cause fever. They don't cause the body aches. They don't cause the severe headaches usually, and the myalgias and everything that goes along with that. So even nausea and vomiting are now being seen with COVID. So these other symptoms, if you have those other things, it's probably not seasonal allergies. And if you even just have the seasonal allergy symptoms, you probably still need to be tested. Now,
going back to the school we were talking about, what else can you suggest to parents that they can do aside from masking their child or children while in school?
Well, you know, masking, of course, is the most important thing. And I have 3 children that are going to be in school this year. 2 in the second grade, and 1 that's going to start pre-K. So we've already had that conversation with them. I want them to go to school, but I want them to wear masks. And, you know, we're paying attention to school. We're becoming involved as parents. My wife and I are. We're becoming involved as parents, and my wife met with the school today just so that we could see who's going to be masked, how they're going to do that, what precautions, are they going to have something to clean their hands, are they going to make sure that the children are careful, just things like that. So get involved, talk to your children, and get them to wear masks.
Thank you so much, Doc, and thank you for watching. We want to hear from you, so keep on calling. That phone keeps ringing, that number 361-573-4366. We'll be right back.
We're back with Victoria County Public Health Director David Gonzalez and more of your questions about COVID-19. So let's get to it. David, here's another question. My friend from India was denied a vaccine after not providing a Texas ID. Does she need a license to get a vaccine?
So we definitely want folks to have some sort of ID, so that way we can check in the state M-Track system to see what their vaccination history is. So it helps us verify that. But traditionally, we have not turned anyone away. We've tried to work with whatever they have as far as identification in any circumstances to make sure that we can get them a vaccine if needed.
What if a person has had the 2 vaccines but lost their vaccination card?
Yeah, we'll be happy to help out. You know, we want folks to keep up with that. It's a very important piece of information. You know, we want you to keep that hard copy. You know, also take a picture if you can, to keep it on your phone, just so you have some sort of documentation. But if you don't have either of those, you can call the Victoria County Public Health Department at 578-6281. We can help you out and try to get you a new one when we get that information.
Here's a question just called in, David. If I already had COVID-19 and I've been tested positive for COVID antibodies, do I just need to get a booster the 8 months after being tested?
No, we're still going to want you to go ahead and get vaccinated, just a different set of protection you're going to get from those vaccines. So we ask you to go ahead and get a vaccine as soon as you're recovered from your illness. There's really no need to wait any time, but go ahead and start a full series of vaccines at that point.
All right, more numbers now, and these from the Texas Department of State Health Services. These are the Victoria County first dose COVID-19 vaccination percentage numbers from late June, late July, and today. On June 30th, 45.4% of Victoria County residents received 1 COVID-19 vaccine. 1 month later, after the emergence of the Delta variant, The vaccine one-dose percentage in Victoria County had risen by 3 points, and almost another month later, the percentage is up nearly 7 points. David, you hosted there at the Health Department a COVID-19 vaccine clinic today. How many more people are you seeing or are you hearing about in Victoria County getting vaccines?
Yeah, and here's one of the pieces of good news that we've had over the past month or two with the Delta variant. And the more cases we're having, the more spread. It's definitely piqued the interest a little bit as well for more vaccinations. So we've seen an increase over the past month or so, which is a great sign. You know, we want to try to get as many vaccines out as we can. It offers just a great level of protection against the virus. So, you know, we have seen that increase, but there's still a long way to go still. You know, we're still, you know, in the mid 40 percentile range with vaccinations. So we definitely want to get that much higher.
Now, recently, DSHS, Department of State Human Health Services, said to KXAN in Austin that over 420,000 vaccines had to be wasted in Texas through the end of July, and over 400,000 have been tossed just since the start of May. David, please tell us how many COVID-19 vaccines have had to be thrown out by the health department here just because they've expired.
Yeah, I can tell you of those 400,000 cases or 400,000 vaccines that were wasted, there was none coming from us due to expiration. We are very careful on you know, how we handle the vaccine. We're judicious on what we order and how much we order. So I can proudly say the staff's done a great job on management of that vaccine inventory, and we have not wasted any doses here due to expiration.
Got one more question for you here, David. What percentage of the people in the hospital here for COVID-19 are under the age of 12 from what you've heard?
I don't have that data, Don, specifically from the hospitals. It's going to have to be one that they have. I don't know of any cases offhand that are that young, though.
One more question here. Can I choose which COVID-19 vaccine I get?
Absolutely, and that's what the more options you can choose where to go. You can choose which vaccine to get. At the health department, we do offer Moderna traditionally. We have special clinics that we do offer Pfizer for those teenagers. But you're more welcome to go in any pharmacy or any clinic to get whatever vaccine you have.
All right. Thank you so much, David. We want to thank Dr. McNeil and David Gonzalez for being with us live tonight. And we're not done yet. We want to hear from you. Call 361-573-4366. We're back in a moment with more of your questions about the COVID-19 pandemic.
And welcome back. Let's take a look at this data from State Health Services real quick. Across the state as of today, there are 13,928 Texans hospitalized for COVID-19. At last check, 233 new reports or new deaths were reported. The number of patients hospitalized with COVID is increasing fast. More and more hospitals across the state are reporting ICU bed shortages. All right, Doug, here's another question real quick. How many different variants are there?
Well, you know, it's hard to give an exact. We go by the big circulating variants that we see. You know, the UK was actually a variant, but now, of course, Delta has become the circulating strain. There's one I've talked about, Delta Prime, I've read about. There's one called Lambda. So I think they're going to continue.
There'll be more.
There'll be more.
Now, how many booster shots are we going to have to take?
Oh, well, that's a great question, and I wish I had the answer. We really don't know. We weren't even sure there was going to be a booster shot needed. It's just going to depend on how the immunity works. And, you know, the optimal, we'd get a shot and then maybe one booster, and then you have lifelong immunity. You know, there's some vaccines that confer lifelong immunity, but this obviously is not one. The other thing to remember is that this is going to continue to mutate. So we're going to see different viral penetration. In other words, we're going to see some vaccines that work real well against some strains and some that just don't work as well.
Now, early on there was talk of people with, let's skip this one. Are people having any issues with third booster shot? I think this one's important.
Well, you know, really, the people that I've seen, there's very few people because, you know, we've limited it so far. Probably within the next month, we're going to be giving it to a lot of people. So we'll see very soon. Hopefully it's going to be, it's nothing new. I think you may have a little bit more of a reaction to it because you're already sensitized to it and you know, in other words, your body already knows that it's there. So it may be a little worse, but it's still better than COVID.
Absolutely. Can COVID-19 vaccines alter my DNA?
Absolutely not. I mean, that was one of the things. Just because it's RNA doesn't mean it's DNA. So it's a complete thing. This is messenger RNA therapy, and no, it does not change your DNA. It's not going to rearrange your genetic pool and turn you into something that you may see on the internet. So that's not going to happen, no.
Thank
They're
you
very
for
safe, very
clarifying
safe.
that. Can I get a routine vaccine at the same time that I get my COVID-19 vaccine?
Well, you know, they've recommended not doing that
Okay.
because, you know, you're going to have side effects from, or a lot of times from vaccines, so they recommend that there be a window between that, and it varies as to where you look, but anywhere from 1 to 2 weeks would be safe.
Now, can I get a Pfizer booster shot if I got the Moderna vaccine, or do I have to wait until Moderna has a booster shot? I know you talked about this earlier, but maybe people that are just joining us.
Well, they recommend that you go with the one that you came with. So in other words, if you got the Moderna, you should wait and get the Moderna. But that's, I mean, you know, the booster is simply a third shot. So it'll be readily available. It'll be easy to have. It's not like they need to go work and produce a specific booster. They have the shots available.
Will the current vaccines protect me against all the variants?
Well, that's a good question, and that's what we want to know. Now, so far, it seems that it works pretty well for Delta, and there seems to be pretty good protection. Although, as it goes on, with time goes down, you know, the immunity is going to wane a little bit and go lower. So we've seen more of the breakthrough infections that we see. But one thing that has not changed, and the most important point, is that hospitalizations have not been shown to increase. So that's important. More people may get the disease, but still very few people are ending up in the hospital, and that's the most important thing.
There's another question I've been asked a lot. Can the booster shot be taken with the flu vaccine? I know the flu shot's coming up real soon.
Right. I would not recommend that. The data that I've seen, you know, it's still new technology, but they don't recommend that you get the different vaccines on the same day.
One last question. Should I have my antibodies checked before I get the booster, and will the booster help or hurt if my antibodies are okay?
Well, here's the thing. The whole antibody thing is a kind of a confusing thing. I mean, you look at antibodies and these numbers don't necessarily confer immunity. So they could be high or low, and we don't really know what that means.
All right. Thank you so much, and thank you so much for everyone joining us.